This week on VA Soundoff, we're joined by Dr. Keita Franklin from VA Veteran Suicide Prevention. So Dr. Franklin, how are things going on the national level for trying to prevent suicide amongst our veterans community?
Thank you. Thank you so much for such a good question, because what we know about suicide is that it is a national issue. So it's a broad public health problem, and it's an issue that certainly impacts veterans, but impacts society writ large. And there's a number of things that we're doing that I'd love to share with you. The first has to do with building partnerships. And that's actually what brings us down to North Carolina today, is this Governor's Council working group where North Carolina sets a prime example for building partnerships and bringing together a wide variety of people and making sure that they're all on the same page and that they're conducting their programming in a coordinated way. So that's one of the things that we know that works: bring together partnerships from the public sector, the private sector, the nonprofit sector. Another strategy that we endorse in the veteran community is peer support. So we know that when service members help service members, or Marine to Marine, so to speak, we know that works, and peer support is an essential part of our strategy as well.
Yeah, I know veterans talking to each other is a big part of what we try to do with our Veterans Coffees initiative that we have, where we have the veterans having that chat time. Instead of having a civilian trying to come in or a doctor trying to tell them what to do, they have these life experiences. What are other ways that are being successful, without getting too much in the weeds? What are some of the ways that are being successful for reducing the number of suicides?
Well, within a hospital setting, we know that that there are a number of techniques that you can employ when people come in and they're at high risk. So making sure that veterans know about the crisis line, that they know how to access the crisis line, making sure that when they do get care, that it's the best quality of care. So we have a number of, we call them evidence-based treatment practices, but things that therapists use in their toolbox, so to speak, to help veterans, and those are certainly science-based, and they bring a high level of rigor to the client-therapist relationship. But you remind me, I'd also like to tell you about the Be There campaign. We have this campaign that we push out with the Department of Defense and Department of Veteran Affairs, and it's really about being there for one another. And I spoke earlier about veterans helping veterans, but also civilians, and just all of us being there for one another and creating an everyday culture where it's okay if you're not okay, and it's certainly okay to get help. So reducing stigma. And the last I would share is just this, making sure that there's access to care. So making sure that when people do have the courage to come forward and get the help, that it's available and ready. So making sure they can get that. Sometimes that means making sure they can get in the same day, and making sure that we're appropriately available with the right level of care as well. So.
And of course, with North Carolina having so many military bases that are active duty members, I know that Be There campaign also is soldier to soldier as well. So it helps cover a lot of different aspects. Because that's another part of the suicide issue, is the active duty, not just the veterans.
Yes, you're right. It's a problem that impacts all broad sector of society. Certainly, we've been seeing an increase in the national data with youth suicides. And so that's why when we're trying to sort of get after the issue, we're trying to employ multiple techniques and measures, and peer support, messaging campaigns. One of the things we're also doing is studying our data, making sure that we know where the heaviest burden is for suicide risk. And we're particularly worried about rural areas. And I know there's quite a bit of rural areas here in North Carolina, and just making sure that rural communities have access to care and resources. And sometimes it's also concrete things like jobs, employment, making sure they have access to the basics, necessities of life even.
I know that you mentioned jobs here. I feel, and I'm not a clinician here, but I feel that the issue of a lot of veterans who are the Vietnam era veterans, they're retiring now. That job is going away that they had that was keeping them busy. Do you know of any solutions that might be out there for what they can do next to keep busy so they don't start having too much time on their hands, I guess is the best way of saying it. And
have risks, I think is really what you're saying. You bring up a good point, because it's connected to this issue of belongingness and social connectedness. And sometimes employment provides that for people. When they can go to work every day and have a sense of purpose and a mission, and they know where they fit in the mission and where they belong, that's critically important. And so what we see in terms of a period of risk is transitioning in between jobs and transitioning from military service to veteran status and or civilian status. It can be a rocky time. It goes well for so many service members transition in and out of jobs so well and into retirement. But there are, for a few, it is a rocky time that we need to have a special emphasis on. And our data tells us that. Our data tells us that we should look at men over the age of 50. over the age of 55 even at times, and that's a unique population that we should do more for. So making sure they're connected through your coffee groups you mentioned is one great grassroots example, but making sure they're connected to veteran service organizations, to volunteer efforts, to family support, and that they have fun and friendship and a sense of belonging. That's what we don't want to lose, is that sense of belonging.